Fox 5 Health News, and there may be a new option for women who need breast reconstructive surgery following a mastectomy, and it could reduce the pain and discomfort that many feel as they are recovering.
All right, joining us now is Dr. Jennifer Caudle. She's a family physician and associate professor at Rowan University School of Osteopathic Medicine. So we're talking about the implants and basically whether they go above or under the muscle.
That's exactly what we're talking about. And for many women who have gone through breast cancer, of course, this is a very emotional, very important topic. But the question is, are there better ways to reconstruct the breasts? And what we're talking about here is there possibly is, in fact, many surgeons are actually doing this. The idea is putting the breast implant on top of the muscle as opposed to underneath, and then covering that with a mesh in hopes that the risk of deformity that sometimes can happen, the way that the breast looks when the implant's put underneath it, or pain or neuropathy, things like that, the hope is that those will be reduced when the implant's put on top. So that's what we're hoping with this, you know. And again, it's not widespread, it's not used widespread, but if you Google it online, which I did, you'll find that there are surgeons that are performing the surgery. And what I like about it is that it's another option for women.
Absolutely.
That's what I love about it, is it's a matter of finding out what's right for you.
Right, you don't want discomfort after already going through an ordeal like that.
And
too,
it's such an emotional time.
It's such an emotional time, and of course, you know, there's still a lot of studies and a little bit more information we need. You know, we don't know how well this surgery does in women who need radiation afterwards. Sometimes there may be a cost issue, but again, the point for me is I like the option.
Yes, certainly promising.
Okay, no arguing with that. All right, well, Coke may be the latest beverage company to consider making cannabis-infused drinks. The soda giant's reportedly in talks with cannabis growers to develop a line of beverages infused with CBD. The drinks would treat pain. You don't get high off CBD, though. At this point, no official confirmation from Coke, but the company says it's keeping tabs on the CBD beverage market. CBD in the past year, I feel the mentions of that have gone up 10,000-fold. You see it everywhere now.
It's like avocados,
Totally.
coconut oil.
It is
the
mainstream in our health-conscious world. That's the big thing. So CBD, just walk us through what that is and how would it work in a soda and what would it possibly benefits be?
Well, first of all, my mind is blown a little bit. I'd be lying to you if I didn't read this and say, oh my gosh, CBD and Coke. I mean, my eyes just got this big. So as you mentioned, though, CBD is a cannabinoid. We find this in cannabis, but as you mentioned, it's not the component that sort of makes you high, so to speak.
Right.
There's thoughts behind it that CBD may help with inflammation, may help with pain and joint inflammation, things like that. And in terms of the press release that we saw from Coca-Cola, that's what they're saying they may possibly be exploring the use for. As a family physician, you know, I'm still a little dumbfounded. I'm kind of in a wait and see moment to see what actually transpires. I'm a big research girl. I still want as much data and information and facts as we can possibly have to make sure that the products that we're using are safe and actually effective for people.
And of course, they'll be very attractive to the wrong group, like minors, kids.
Well, you know, and that's the other thing, is making sure that people are kept safe and that they're used properly if this goes forward. So I still say lots of questions here, but again, it's kind of amazing. It's an amazing concept.
It's the world we're moving into.
See it everywhere now. All right, thank you, Dr. Caudle. We appreciate it.